All righty. Well, I just want to say a big happy Friday to everyone. Though, again, at this point, do we even know what day it is anymore? No, but if you know that if you are tuning in right now to Roswell Park's Ask the Experts webinar series, you definitely know it is Friday. So, welcome to everyone who is joining us on our lunch hour. I am Rebecca Vogt. I'm the Media Relations Specialist at Roswell Park Comprehensive Cancer Center in Buffalo, New York. Now, for some of you who are joining us for the first time, we do want to welcome you. We hope you find this series both informative and very helpful. And for those of you returning, we're glad to have you back for yet another week. Thank you so much for taking time out for all of these chats. It's been fantastic to have you on, and we'll be sure to cover new questions today. Now, last week we did discuss the very important topic of mental health during COVID-19. That full video is available for on-demand viewing on both our Facebook page and on our YouTube channel, as well as the website that you go on to sign up for these webinars, which is roswellpark.org/patient webinars. Today, just another extremely important topic. We're going beyond just the issues surrounding COVID-19, and we're going to begin discussing advice in general for those who take care of cancer patients, the ever important and ever appreciated caregiver. We do all know that cancer does not just affect the patient, it affects friends, families, coworkers, every single person in their world. And today we did want to narrow in on some of the advice for caregivers, whether it be a spouse, a child, a friend, or just someone who has given up so much of themselves to help the person they love during such a difficult journey. We are very fortunate today to be joined by Dr. Elizabeth Gage Bouchard. Dr. Bouchard is an associate professor of oncology in Roswell Park's Department of Cancer Prevention and Control. Dr. Bouchard, thank you so much for joining us today. Can you first kind of share a little bit about yourself and what you do at Roswell?
Absolutely. So at Roswell Park, I direct our Care Lab, which is a team of researchers focused on understanding more about caregivers' experiences. So we know that caring for each other when we're sick can be one of the most beautiful things we do as humans, but there's also parts of it that are just really hard. And so our team is really dedicated to understanding more about experiences that different caregivers have so that we can design programs to help support them more.
Thank you for that. Appreciate it. We do know that cancer caregiving, it can be very rewarding, but it can also come with a lot of unique physical, emotional, and also spiritual challenges. This sort of like new normal that everyone keeps talking about and uncertainty that we're experiencing around COVID-19, it's made this role potentially a little bit more difficult to navigate. And we are here today to provide as much advice as possible within the next 30 minutes. We do have several pre-submitted questions to kind of go through first. However, you can also access the chat feature down below. There's a little bubble that says chat, not the Q&A, but we prefer to use that chat option to submit your own questions throughout our time here today. Please make sure when you send your questions, send it to just the panelists, or you can even check the box that says anonymous if you do not wish to have your name associated with your question. So with that, we will open it up and get it all started. So Dr. Bouchard, something that we kind of want to go over first is I'm sure this is a feeling that a lot of caregivers kind of tend to have, but I feel guilty taking time for myself. Is this normal?
Yeah, so that is one of the most common things I hear from caregivers. Another way that caregivers often will talk about this is feeling really selfish when they do things that's not directly related to caring for the person with cancer. And one of the really important things to remember within this is even though the caregiver and the patient are really on the same journey together, their experiences of that can be very different. And one of the things we're finding out more and more from research is that often caregivers report more stress and anxiety than the patients do. And so thinking about doing things for yourself, self-care, keeping yourself well, it's not selfish at all. In fact, it's really critical so that you can be strong to help support the cancer patient through their journey.
That kind of all being said, I'm sure there's a lot of, stuff on their shoulders. I mean, and that's something that can weigh a person down, weigh a caregiver down. How can these individuals stop feeling so stressed and worried?
Yes, yeah. So I think thinking about it in two different ways. So if caregivers are feeling a lot of stress because all of the new tasks that they have to do, all of the learning they have to do about the patient's treatment, one of the things that can be really easy or helpful within that is to actually write all of the new tasks you have down, get it out of your head onto paper, and then really divide it up into more manageable parts. And that can help us feel a lot more stressed and overwhelmed about all of these new things that we're taking on. But in addition to that, we know that caregivers just experience a lot of worry and fear. And so one of the main things within that is to really check in with yourself and assess if it's something that you think you need to talk to either your primary care provider about or the care team, and they can help direct you if you think you really need more resources for this. But as far as just kind of day-to-day stress, I think there's three major kind of global things we can do. The first is we know connections with other people help a lot. So in, being around friends, being around other people can help. The second is what I think globally is about just kind of healthy habits. So getting enough sleep, exercise, good nutrition can be really helpful. And then a third strategy that there's a lot of research showing that it helps is mindfulness and meditation can help get us out of those stages of feeling a lot of worry and able to calm down some of those feelings of stress.
And an interesting comment coming through, I just would like to thank the individual who submitted this and said, I've always said, even not just taking care of my husband with cancer, but also taking care of my elderly parents, that if you don't take care of yourself, you cannot give the proper care to those who depend on this. That's very well said to the individual who commented that. So yeah, definitely something to keep in mind. Here's an important one. I mean, right now, a lot of people are working from home, but there are still some essential people that have to report into work. So, I mean, how do you do that balance of, you have your paid work and yet you have caregiving happening?
Yeah, I mean, that is one of the really big struggles that people experience, and it can look different. So if you work for a large employer, there might be strategies for shifting your work hours or programs you might be eligible, like FMLA, for example, but those don't apply for everyone in everyone's different work context. One of the things that I've really learned from working with caregivers that can be really helpful is to use the cancer care team as a resource within this. So they often have a very good sense of what the arc of the treatment is going to be, and can give you really good guidance on, if this seems really intense right now, but will settle down in a couple of weeks, or if you are going to take time away from paid work, strategically what points in the patient's treatment that might become most useful for you.
Just to kind of switch just right back to like what you were talking about before, you mentioned mindfulness and meditation. Can you kind of talk to us a little bit about what is mindfulness?
Absolutely. So really broadly, mindfulness is a strategy to focus on moment-to-moment experiences in a non-judgmental way. And so through mindfulness practice, we really learn to stop worrying about future events or thinking about or ruminating about things that have happened in the past. And it gives all kinds of toolkits to really tune some of those things out and really focus on what's happening in the here and now, which we know for caregivers can be a very helpful tool because of all of the uncertainty that they're managing in the day-to-day.
So you kind of actually talked a little bit about this before, just with your kiddos kind of being out right now, I think with your husband. But this is something to also bring into the mix, having kids, and especially with this question, having small kids, and also caring for a loved one with cancer. How does someone do it all?
Yes, yeah. So to loop everyone else, and Rebecca and I were talking before this that my husband is driving around in circles right now with my two toddlers in their cars. So for all of our caregivers out there, I feel for you. And it's really difficult. It's quite common for caregivers to be caring for both small children and a parent or other loved one. who has cancer, and these are often caregivers who report the highest levels of stress. And certainly right now, amid COVID, people are balancing all kinds of new schedules, needing to not just care for your children, but also be their teachers. And so quite literally, there are too many things to possibly do. I think there's two kind of strategies that can be helpful in the situation, and they both are around this idea of reframing. So one of the things is when you're thinking about all of the things that are worrying you and all of the things that you need to do in a given day, pretending that you're your best friend, giving yourself advice, and sometimes that can really help you see things more clearly. We know we're often more kind to our friends than we are ourselves. And another is what we call temporal reframing. So thinking about in 6 years or in 6 months or a year, of all of the things that I feel like I have to do today, which ones do I think are going to be really important? And where will I feel like it was really worth prioritizing? And both of those strategies can be helpful ways to make these really hard decisions about how are you going to balance it all?
We go from kids to sort of the older population. A comment coming in asking that, so Erie County Senior Services, they have a respite program for those over 60. Do we know if there's any other such services available for younger caregivers?
Oh, that's really interesting. One of this is going to vary by region and to region and where people live. So this is one of the questions that I think would be, our social work team at Roswell can certainly help in, with a specific person's given context to help connect them with different respite programs. American Cancer Society also has really great resources to help navigate people to specific services and to identify ones that a specific person might be eligible for.
Fantastic. Great. I don't want the patient to feel like a burden. Now, that being said, who can the caregiver turn to talk to about how they're feeling?
Yeah, this is a very common experience that caregivers have. Often the person we're caring for, it's our person. It's someone we're extremely close to, and it's the person that we would normally talk to about concerns we're having. But there's also this feeling that we don't want them to have to take on some of the pressure that we're feeling or to feel badly. And so one of the things that we've really found is connections among cancer caregivers can be enormously helpful in this. So caregivers will talk about how when they're around other people in this similar situation, they can really provide really tailored support to each other. They understand what each other are going through. So that can be a resource. You might connect with each other through support groups. There's many Facebook groups to help connect people.
That does kind of beautifully lead me into sort of the next question, but I mean, how do you ask others for the help that you need? I'm sure it's probably difficult to, make that first step and get out there. But so what would you suggest? How does someone do that?
Yeah, so that can be very tricky. And one of the things that we hear from caregivers a lot is that people will make really vague offers of support. So they'll say, if there's anything I can do, please let me know. But that caregivers, sense that might not really mean I'll come over and mow your lawn for you. So there's all of these kind of tough interpersonal dynamics related to getting the kind of support you need. So this is where really writing down all of the tasks associated with caregiving can be really helpful. And that can help a caregiver think about, are there things that I know people that that I could specifically ask to help with some of these tasks? And then, reaching out, or, some of caregivers that do this really successfully, they almost manage their social networks like a small business. So if you have someone in your family who can help field a lot of offers of support and can take that task off of you, some people will design food signups where, people will come and take a night of the week to deliver food, or for caregivers who have young kids to help provide childcare.
A couple other questions that we have coming in. This now also sort of shifts to, being a caregiver and having, siblings. So it says like, I'm a caregiver for my mom. I want to ask my siblings to help more, but I don't know how to do it without making everyone mad and also offending my mom. How do you manage that?
Yeah, I mean, that's very interesting. And, all of these experiences happen in a context, and families have histories, friend groups have histories. And so it can be very difficult to help to manage those dynamics also while providing care for the cancer patient. One of the things that I think is really important with all of this is, as a caregiver, to really think about what you're able to do and what your limits are. And it's okay to have limits within that. And then in thinking about other people in the family that might be able to help support those roles, maybe just specifically communicating, these are all of the tasks that go into providing care for mom on a given day. And these are the ones I'm able to do. What are we going to do as a family to help fill in the gaps there?
A collaborative effort all around, for sure. Another question coming through is, how do you keep a patient on the recommended recovery or treatment path without being naggy or too pushy?
That can be really difficult. Within this, it's important to remember, right, that the treatment decisions and the course of care are the patient's decision, right? And so within that, if you can certainly help communicate the difficulties that the patient is having in following the recommended treatment to the care team, and make sure that they have the information to help support the patient within that. And if decisions about the course of care are impacting the tasks that are being put on you as a caregiver, you can also be really clear with the patient with that. So for example, if a patient prefers to receive some treatment at home, but that would mean that you need to provide IV medications, for example, and you're not really comfortable with that, be upfront to both the patient and the care team, and they could either help provide additional resources or training, or that has to go into some of the decision making.
Now, does Roswell have a caregiver support group, or something that our caregivers can turn to?
Absolutely. So we have numerous support groups, one explicitly for cancer caregivers, and then some of the other support groups are open to cancer caregivers. So definitely check our support group page to identify those. And we also have a number of wellness programs, all of which are open to caregivers. So we have mindfulness, meditation, we have yoga classes, also just kind of more fun things, paint nights, and those can be very effective strategies to connect with other cancer caregivers and people going through this. So I definitely recommend people, if those are appealing to you, to take advantage.
Though also at this time, I mean, I'm sure a lot of things are kind of on pause right now. So it's, like I know you mentioned yoga. I'm sure, like, caregivers, if they have a moment, to do mindfulness and meditation, there's such a variety of resources out on YouTube. You can, 30-minute yoga video, 30-minute meditation video. So kind of adapting during this time, right? That sort of, when we don't have, you can't go out and do a paint night, can you, bring it into your house sort of thing.
Right. And that's one of the interesting things amid COVID-19, right? We're all getting more experimental and innovative with making some of these programs virtual, which actually serves caregivers a lot, because often caregivers aren't able to leave the patient or prefer not to leave the patient. And so all of a sudden, there's so many virtual resources, both to form connections with people or to do some of these. And I have to give a plug. We do have some videos on the Roswell Park site. So we have yoga videos and meditation videos that people can see.
Fantastic. Excellent. Yeah, no, definitely check those out. I've checked them out myself before. They're wonderfully done, and an excellent watch. You touched upon it a little bit. This kind of leads right into our next question. You said that sometimes that caregivers don't want to leave the patient, but however, what happens if someone is feeling isolated? However, they're having that back and forth feeling of like, I can't leave, my loved one. What can I do?
Right. Well, this is another one of the times that, the world has quickly really accepted doing Zoom meetings and virtual conversations. And so, certainly I think there will be more opportunities for caregivers within that. But one of the really interesting things that's coming out in research is that we know connections with people that we have really close relationships help, but also just small interactions with strangers have a very powerful effect in our daily mood. So striking up a conversation when you're sitting in a waiting room, talking to the mail carrier when they walk by, those have a surprisingly powerful impact in how we feel and in lowering our feelings of stress. And so a big recommendation I would have that the science is really clearly showing is to know that and to find opportunities to let those interactions into your life. So put down your phone and try it out. Strike up a conversation when you're in line or when you're sitting in a waiting room, and then note, do you feel more connected? Do you feel a little bit better after that? And I bet you will.
And speaking of putting down your phone, how does this is applicable both now and kind of moving forward, but in a time of COVID, and then also, as if we slowly start moving forward to whatever the new normal is, how does someone manage information overload? I mean, how do you balance doing your due diligence, researching without going down a big old rabbit hole?
Yeah, that's tough, right? And we know that people have all different kinds of preferences for how much research that they do on their own versus how much that they just kind of follow what the physicians are telling them. So a few tips I would have is to really think about the information sources. So to try to really limit your seeking of information to well-vetted scientific sources, and the care team can help easily direct you to this. So, university sources, the academic literature. We know from some of our own research that if a search for information starts with Google, that can often lead to more confusion and feelings of overload. So, to really try to find a few trusted sources. Maybe it's the NCI website, maybe it's the Roswell Park website, and then ask you, the care team, to help you, direct you to further research.
The strong message that's carrying through this entire chat is care team, care team, care team. They are here for you 100%, 110%, if you will. This is a very interesting one. I tell my friends I don't have time to do things because I'm so busy taking care of my aunt, but they just don't get it. I mean, this is very emotionally and physically exhausting, caregiving as a whole. How do you explain that to your friends and family? Well, actually friends in this case.
Yeah, I think that is one of the really hard things. And one of the things we see in our own research is that, around the diagnosis crisis, people get lots of support and people really understand what the caregiver is going through. And then that typically pretty quickly falls off. And so it's hard for people to understand that, for a long period of time, maybe a year, maybe 5 years, that the caregivers are really still in the thick of this, and making plans can be a really challenging thing to do. And so my advice in that context would be to go easy on yourself. Know your limits, know what you're able to do, and hope that your friends will understand.
Yeah, one hopes they would. If they're your true friend, they will understand for sure. Another interesting one coming through. These are all very interesting. I want to say to everyone, so these are all very interesting questions. We thank you for them. I used to take my friend to every chemotherapy appointment, not allowed to anymore because of COVID-19. I feel guilty for how relieved I am. Is it normal to appreciate the break?
I think absolutely, right? So I think this goes back to really appreciating how difficult it can be to fulfill all of these caregiving roles. And I think so often, so much of the focus is put on the patient's experience, but thinking, as a caregiver, you're also on your own cancer journey throughout all of this, and all of the demands of the treatment schedule are also demands on you. I would imagine it's very typical to feel relief when some of those fall off. Um,
So another thing, and I know we did kind of briefly sort of scratch the surface of it just before, but what happens if, a caregiver is saying, I don't have time or energy to eat right and exercise? Like, what do I do in this case?
Yeah, that's a very common thing we hear from caregivers that, throughout the course of the patient's cancer treatment, they gain 25 pounds, they feel like they'll go all day without eating, and then they know they're making really unhealthy choices at night, but they just don't have the energy. And I think this also goes back to some of those stress management tips. So knowing that if you do, when you have 10 minutes or 20 minutes, if you're able to use that, doing some form of exercise or helping to prep some healthier options in your fridge so that they're easier to grab later, that it will likely help you feel better as time goes on. Another helpful thing within all of this, I mean, we all struggle with making healthy choices, right? Even when we don't have all of these additional demands. And it can be very helpful to think about what is the point that if you get past it, you're just going to do it, right? So for me, if I change into my workout clothes, I will work out. If I cut up salads and make them, I will eat the salad the next day for lunch. And so identifying those kind of sticking points within your day, and just proactively helping to do them.
Good point. I defrosted a salmon last night, so it's in my fridge right now. I have to have it. So no, I get where you're coming from there. One other question that we see coming through in the chat. So individual is caring for their brother who was just recently diagnosed right at the same time that, everything with COVID really just exploded. They have many siblings. They're all asking questions, and finding the time to update everyone is kind of difficult, especially with so many questions coming through. Do we have any website that is specific for families to access to receive updates, instead of doing things like, cell phones and group texts, et cetera, et cetera? I want to say care team, but I will let that go to you.
Yes, yeah. So this is something we hear from caregivers all the time, that after a long day, if it's a particularly important day in the patient's treatment and you spend a long day up at the hospital, the last thing you want to do is spend all night calling each individual person, giving them updates. And so caregivers have come up with all kinds of really cool ways to get around this. So there are some websites that can help with this. So for example, Caring Bridge is one that many people find helpful. You can have very secure privacy settings where you only let certain people view the account. And so that can be a helpful way if you just want to post a specific update in a private way. Now in this age when we're all on Zoom, having one family meeting at the end of the day might be helpful. I've heard from some people where they'll make their voicemail message the daily update, so that people can just hear it without them having to respond to individual texts. So, I mean, these are some of the small little hurdles that become big burdens on the caregivers.
Very unique options. I do know, yeah, CareBridge is definitely something that I've seen utilized quite often, but yeah, the voicemail, that's a new one for me, hearing that one. Here's a wonderful question to really round out our conversation as our time draws to a close. I'm a patient with a wonderful caregiver. How can I show my appreciation?
Oh, what a wonderful, what a wonderful question. I mean, I think in a big way, it's to kind of recognize all of the work that they're doing in this, and that, you know, you really see it, and you really deeply appreciate it.
Fantastic. Excellent. As we get very close to our end time here, Dr. Bouchard, I kind of want to just lastly, one more time, open it up to the floor to you. Is there any sort of closing thoughts you want to give to everyone who is tuning in today?
I mean, just that, you know, the caregivers are a critical part of the cancer care delivery team. And increasingly, we're really appreciating that we wouldn't be able to provide the care to cancer patients if caregivers weren't doing all of this behind the scenes work. And some of that is the medical tasks, but, you know, doing the laundry is also really, really critical, and helping provide emotional support to the patient is really critical.
As I think so many of us have heard before, not all superheroes wear capes. So important thing to go off on that note. Dr. Bouchard, thank you so much for taking time out of your day to join us. And then also to all of our participants, whether you're on your lunch break or, you know, you have the day off, or, you know, like also Dr. Bouchard, your kids are being driven around right now. That all being said, thank you, thank you, thank you. Now, if any of your questions were not answered, we do encourage you to reach out to your care team, as was so much emphasized during this chat today, as well as also tune in to future webinars that will address even more topics and questions. We do consistently update our COVID-19 page on our website, and that has additional FAQs and more. You can check that out at roswellpark.org/coronavirus. The video from today will be available to view on demand, and also a link will be sent to your email. So anyone else, any other caregivers out there that have not had a chance to watch this, forward it along to them. I'm sure and hopefully they find it just as informational as you have today. We do encourage you to additionally stay tuned to roswellpark.org/patient webinars, and also your email to register for any upcoming webinars, which again, we continue to offer on Fridays. That all being said, again, happy Friday. Have a good weekend, everyone. Thank you again for tuning in. Bye, everyone.